Well, ANC President Cyril Ramaphosa is today expected to visit the victims and bereaved families affected by the bus crash in Limpopo last Saturday. 5 ANC supporters died and several others were injured when the bus they were traveling in hit another vehicle and rolled down an embankment in Magoeba's Kloof outside Tzaneen. The bus was transporting party supporters to the ANC's 112th anniversary celebrations in Mbombela and Mpumalanga. Ramaphosa will start his visit at the Mankweng Hospital outside Polokwane, where some of the injured party supporters have been admitted. He will then proceed to the Botlokwa Hospital to visit other patients. He will later meet the bereaved family members to convey his condolences. Well, for more insight on this, we cross live now to our reporter, Pimani Baloyi.
You are right. The president is scheduled to start here at the Mankweng Hospital. We're coming to you live from the Mankweng Hospital, where President Cyril Ramaphosa is expected to visit those people that were injured in that bus accident this past weekend. Naledi, as you were mentioning, there has been changes to the program. I've seen the removal of that visit to the Botlokwa Hospital. But to speak more about this program, I'm joined by the Deputy Secretary General of the ANC, Ms. Ramaphosa. Mr. Magoeba, let's speak about today's program. We've seen two programs. The first one mentioned that the president would also visit another hospital to visit this. But tell me, what is the official program? What time is it expected to start? Which areas are we expecting the president to visit?
Good morning. We are going to start here in Mankweng Hospital. We will then now visit the patients that are still here and, of course, do a tour of the hospital itself. We will then now later go to Botlokwa Hospital. And after that, we will go then and meet with the patients that were discharged in East Lebanon. After that, we will then now go and meet with the families of the deceased comrades, 5 of them. So that is the program of today.
Let's talk about the deceased comrades. What sort of support can we see the party giving to their families? Are there arrangements for a memorial service, funeral service? How far are those arrangements going so far?
Yesterday, the provincial leadership and the regional leadership, including the branch leadership, did go and visit the families of the deceased comrades. And we are definitely going to give support in terms of the funeral itself. The provincial leadership, of course, is still planning in terms of the memorial service and exactly how the funeral arrangement. But of course, that will have to be an arrangement, an agreement that is done with the family. We cannot just do it on our own. And because it's not one family, consultations is still ongoing. After the consultation is done, we'll definitely be able to communicate exactly when we will be able to do the memorial service. However, the organization will definitely take responsibilities in terms of making sure that our fallen comrades do get a good and befitting farewell.
Before I let you go, I want to find out what time do you expect the president to get here? I've seen Premier Matabata, the chairperson of the ANC in the province, already arriving. What time do we expect the president to be here? Who else can we expect?
The president has already landed, so we can expect him anytime soon. The provincial secretary of the province will also be here. Of course, the premier is the chairperson of the province, and of course, PC members such as MEC Popi is also here. So a number of people are here, including other PC members and regional leadership.
Thank you so much for your time. Naledi, as she was mentioning, some of the PEC members are already here. That includes MEC Popi Ramatuba, Dr. Popi Ramatuba. MEC, in your head as MEC, before we talk about the ANC staff, what is happening? How is there any recoveries? We know 9 people were still hospitalized. How far is that process? And also looking at the deceased, processes of ensuring that the families get their death certificates, the postmortems, how far is that going?
Morning, Pimani, and morning to your viewers out there. What we can confirm is that, yes, out of the 57 patients that we received in our different facilities, 9 will remain admitted. However, we've got 2 more patients who were part of the first bus. From the accident scene, they felt they were okay. unfortunately, they decided to go. But when we were informed that they are not feeling well, we immediately arranged that they are seen in Botlokwa. 2 of those have been admitted. So that's why we've got a total number of 11 patients who are admitted. The 2 are not the part of the 57, meaning we will now increase the number to 59. But what is encouraging is that the rest of the patients are being treated for psychosocial, because you will understand that when you're involved in an accident, especially a horrific one like the one we saw, the bus going down 20 meters, that thing can, if not treated mentally, you might suffer post-traumatic stress disorder, which can lead you into serious mental disorder in future. So we are working with social development, our social workers, our psychologists, depending on the severity of the impact. Then at the same time, in terms of the postmortems, we agree with you, and we made a commitment as the department to say on Sunday we were going to meet with the families, which we did for positive identification. It went through successfully. So by yesterday, which 10 o'clock to 12 o'clock, our postmortems were already done. Members of the family had already received their loved ones, and we have already discharged the bodies. They've gone to the private undertaker. So as it is for now, even the death certificates have been done.
And MEC, I've seen on the program you'll be taking to the president to the MRI unit. What else are you going to be showing him in terms of the care that this hospital can offer to patients?
I think this is one of the service of excellence where we made an undertaking some few years back when I came here, and I told you, I think I was with you, to say we're going to start with our own internal maintenance, and we did that as a department in-house. And you can see when you go around, and we would want the president to see the highest technology. This hospital never had an MRI. It's a rural hospital. Our patients queue for long. Some have to go outside the province. But we are saying this cannot continue to happen. We are this is also a teaching hospital. So we will be making sure that he sees how did we successfully treat COVID. He will see that the money that he gave us to build field hospital, we refuse to build field hospital, and we renovate and build our own in-house ICU. We will take him through to say the budget that people say, what did we use it for? Yeah, it is. That ICU now, it's being used even today. Had we built a field hospital after COVID, it would have been dismantled. And many of you were asking me, why can't you have a field hospital in Petersburg, in Peter Mokaba Stadium? And I told you, the budget we have must be used in a manner which we will be able to say, even in future, this is the legacy of the grant that we received during COVID-19.
Just to put you on the spot now with your cap on as a PEC member, I've seen the chairperson of the party, the provincial chairperson here. There was speculation on social media that perhaps he might have joined MK. Does the president have the full support of the PEC?
I think you would have seen the statement that the PC has released, and our provincial secretary together with the spokesperson were very clear on that matter. Our provincial chairperson is a committed cadre of the African National Congress. From the accident scene, if you have seen, we were with him. He was there, done in the regalia of the ANC. You have seen me and him. Of course, I wouldn't wear ANC regalia when I go to hospitals because of ethical reasons as a doctor. But he, as an African National Congress chairperson, he was there. So the president of the ANC supports the PC of Limpopo. That is what we all know, because it's public knowledge. Speculations will be there because people thought we will not fill Mbombela Stadium. Now that the stadium is filled, they must come up with other propagandas. We are focused on delivering services. President gave us a marching order, even though I was not there physically, but we received the message. He gave us the marching order, and what is important is that our people receive services. For instance, Pimani, if I can share with you how the people who are committed, you know Professor Steve Machize, for instance, is a son of the soil, but he's a head of orthopedics in Free State. When he saw the bus accident, he called me and he says he knows the pain that we will go through, especially we are coming from festive season. There are many patients who were involved in an accident during festive festive season, and they are on the backlog for orthopedics. And now you have got a bus from the ANC. We are in dilemma, and we can't prioritize ANC comrades over the other because we are the leader of the society. All patients are ours. He said, as a son of this movement that has raised me, I will organize orthopedic surgeons from as far as Cape Town and Gauteng to come to Limpopo and clear the surgical backlog so that we don't only be seen as treating ANC members, but we treat all the people of this province. So that's what we must focus on, not on these shenanigans that people are asking you to ask me. Ask me about what am I doing with surgical backlog. I'll give you answers, not gossips.
Thank you so much, MEC. That is the MEC of Health here in Limpopo, Dr. Popira Matuva, speaking to the President's visit that is expected to start here at the Mankweng Hospital at around 9:30 this morning. The President is then later expected, as you heard the Deputy Secretary General of the party explaining, that he will be meeting with the families of the 5 people that passed on during that car crash, but also meeting with the survivors of that car crash later on at a community hall near Botlokwa. Naledi, I'll hand back to you in studio now.
Pimani Baloyi on that story for us in Limpopo. Thank you so much for that update.